So welcome everybody to the Net Patient Network Day today. We're delighted with the attendance, particularly the terrible weather that we have. But my name is Mark McDonnell and I'm the Chairperson of Net Patient Network. And the purpose of today is multiple fold, but it's obviously about getting information and getting knowledge about the disease, but it's also very much about meeting other patients, getting to hear other people's stories, seeing that we're not alone as we fight our disease, that we can hear stories, positive stories, some maybe not so much, but we get a sense of community. And that's one of the objectives of Net Patient Network, to make a community of this small group of people in the country that have this rare disease. So I know myself, I was diagnosed 3.5 years ago, and being told I had neuroendocrine tumours, it didn't mean anything. I never heard of it. Nobody I knew had ever heard of it. And there's such a lack of information, and you feel alone and scared and wondering what's going to happen, what is the future going to bring. And really my own dealing with it was transformed really when I went to Cork. There was a patient event added on to a medical conference down in Cork. And for the first time I met other patients that had this disease. I got a real positive sense of the future and where this might go, that I could deal with it. And I've also met lots of friends and other people through this, and it's been wonderful. And the sense of community is excellent, and one that we really need to nourish and make better as we move forward. So this is actually the second event that we as a patient group have organised. The first one was last year in Kilkenny, and it was a great success, and I think today is going to be as successful, if not better. We should acknowledge that it's Tommy Gorman's vision to bring together a group of patients to come and help each other out, and also to advocate and work for better systems in the country. As we know, it's a rare disease and it's often lacking information in the medics around the country, and that's something that we as patients have to deal with. And it's our lives. We have to take control of the situation, control of our pattern of care, know when we have to get scanned, know what they are, what they mean, make sure we have them done in time for our consultant visit, and all of those things are important. We actually have a consultant planner that unfortunately didn't arrive on time, but it will be here later on, and I'd like you all to take a few of them, and it just gives you some indication of planning your consultant visit, what you should be reading, getting your CGA, your 5-HIA if they're relevant, CT, MRI, putting down your dates, making sure that they're all there. So please pick some of them up later on. Having said that about the lack of knowledge, we actually have a very wonderful group of doctors in the country that are working on our behalf, and they're very meticulous and tirelessly working. And most of them are here today, and we're very, very thankful of that. And they work very closely and encourage us a lot. So also what's happened is the NCCP, which is the National Cancer Control Programme, and they really run all the cancer services in the country. And about 1.5 years ago, they appointed Dermot O'Toole to begin the process of making a national system for dealing with NETs in the country. And that is recognition by the NCCP of our disease, and the first steps towards making it a really comprehensive system around the country. Because we want people, whether they're coming from Donegal, Kerry, Cork, Dublin, wherever it may be, that we all get equal access to care and equal treatment in making us basically live longer, survive longer. So we're thankful, of course, to the NCCP for putting that in place and promoting and developing it further. Also, the hospital here today is one of the major prongs of the system for dealing with NETs. And as most of you will know, Donald O'Shea created a clinic, a NETs clinic here many, many years ago, and that is now migrating into the National Centre for Dealing, along with the hospitals in Cork and Galway. So what I'd say to you is please use the day to maximise the amount of information you can get, to try and reach out to the other patients in the room, make friends. We can all support each other and help each other as the years go in. I just want to acknowledge at the outset that we've created a fund, a NETs fund, research fund within Vincent's, and unfortunately some people have passed along the way, and their families have been donating money, and they want to see money going to good causes. So there's the McKenna family and the Cullen family have been very, very generous in the monies that they've raised. So I just want to say that in case that you don't want to stay for the whole day, because it can be difficult with your relatives having passed away. But we will have a presentation of the monies that they have collected just before lunch. We also have a Q&A session with the doctors that I've mentioned. So that's a very good opportunity for people to ask questions and get answers from a wide panel of viewpoints. We are videoing everything, but please know that we won't be videoing any of the questions that are asked, and they won't be put up on the web, just the answers. I'm sure the doctors don't mind being videoed.